like to take this opportunity to congratulate all my colleagues with the International Translation Day, and thank you very much, Transnational and Hayden, for this remarkable opportunity to connect with the colleagues on that day. So today I would like to talk about telephone interpreting and some challenges and solutions of telephone interpreting, including the suitability and quality of telephone interpreting. So here's a question to you. What would you prefer, on-site interpreting or telephone interpreting? You can just answer for yourself, but in one of the surveys that I found of 2017 in Australia, that was done and sent out to about 500 interpreters that usually work via the phone, the majority of them preferred on-site interpreting. But telephone interpreting is becoming more popular, especially in the COVID environment, isn't it? And it raises some serious questions that I would like to raise today, such as telephone interpreting being used in inappropriate situations, and sometimes interpreters' dissatisfaction with the low remuneration for telephone interpreting. But the main challenge is usually around the accuracy of telephone interpreting. So maybe before even that, I will introduce a little bit the subject. So usually the term remote interpreting refers to the use of communication technology for gaining access to an interpreter who is in another room or building, city or country, and who is linked to the primary participants by telephone or video conference. And remote interpreting includes telephone interpreting, video conference interpreting, and video relay interpreting, which is used mainly for the sign language interpreting. Also, remote interpreting has been widely used for simultaneous and consecutive interpreting, mainly to optimize access to qualified interpreters, also save time of the clients, save their time for traveling and money. But nowadays, in the times of the pandemic, it is becoming an essential service that is preferred by the clients. So as the most common form of remote interpreting, telephone interpreting is predominantly used for dialogue interpreting in the consecutive mode in community settings. And that's what we do here in New Zealand, and also when we work for the Australian market, that are most usual circumstances for telephone interpreting when you are based in New Zealand. So let us look at some challenges and solutions step by step, perhaps. So some of the challenges and solutions before the call. Since we cannot communicate right now, and I'm the only speaker, that's the system allows to do that this time. I'd like you to think perhaps what would you need before the call to make the call successful? I'll give you a bit of time, but my advice and recommendations would be wear a headset with a microphone so that your hands are free, and so you can write or type when you need. Also have a computer or laptop ready with access to the electronic dictionary, for example. So you can check some terminology if needed. Also be equipped with paper and pen. That will be very useful when you need to write down some numbers, especially, and some other precise information like geographical names, proper names of the people, because we already mentioned that usually telephone interpreting is used for consecutive mode. So you will have to train your memory and keep in your memory some pieces of information. So writing down some important information especially is paramount. Also be aware that most calls are recorded, if not all calls. It will depend on your employer, but I worked for the last 6 years as a telephone interpreter for two main employers. One was Language Line that now this program was shut down by the New Zealand government, and the tender was announced last year. And Easy Speak now is one of this telephone interpreting employers for some of the of New Zealand interpreters here. So I also work for them now, but they also now added to our scope of work Australian market. So Easy Speak records all calls. So at the beginning of the call, what could be some of the challenges? Well, I would ask for a briefing if it's possible. Sometimes it is not possible because you are connected without any warning, without any prior booking. But if it's possible, ask for some briefing when you are still with the operator, or when the patient, for example, in the hospital situation has not yet came into the room of the doctor or nurse, and they can brief you, at least give you some understanding of the surroundings, of the number of participants there, and perhaps briefly describe the situation that is right now, you will work in right now. But please do not make any assumptions about people or events or even small details. You probably are aware about conscious bias that we all have when we hear something or see something. We assume things. We assume when we in our situation, when it comes to telephone interpreting, it is very challenging because we don't have any visual assistance. But even when we hear something, we can assume that this person, for example, is intoxicated if they repeat something, but they may well have a heart attack or something. So please don't assume. Just try to work with what you have and be fair, be impartial, be professional. Also, at the beginning of the call, signal any acoustic or poor sound problems to the operator or doctor in the hospital situation, or to the client that is the main client to you, or the person who connected to you. Ask them either to call again if necessary, or make sure that you state this poor technical characteristics of the call. Introduce yourself in both languages. What would be the possible introductions? Well, usually it also partly the rules of the employer. They will tell you whether you are allowed to tell your personal name, at least the first name, or not, or you would just be referring to yourself as the interpreter that usually you do in any case. But perhaps one of the introductions could be, hello, my name is Olga. I'm the Russian interpreter. Please state your language. Sometimes there are situations when the operators connect you and somebody needs Bulgarian language or Polish or some other language, and make sure that you state your language again for the people that you just connected with, so they hear that and confirm or signal flag if it's not the language they need. So when you introduce yourself, you can say that you will be interpreting today for these clients, and you can also set up the rules straight away. You can ask them to probably talk in 2 or 3 sentences and make a pause for the interpreter to interpret for them. If you do not set up the rules, then it will be later on, it could turn into some chaotic discussions. So please make sure that you are the speech traffic controller here. Also, do the same in the other language, and then you can start interpreting. Also, when you introduce yourself, you can remind the clients that you interpret everything they're saying, and do that in both languages. This is important because sometimes clients during the call can become frustrated or emotional, or even angry. So you have to remind them that everything they're saying is interpreted by you and has to be interpreted. So during the call, what can go wrong? Well, everything or anything, I would say, can go wrong. What the main challenges could be? Well, as I already mentioned, proper names, the names of medication or dose or diagnosis if we're talking about the hospital situation, or if it comes to the matter of police or some detention centers, sometimes we have phone calls as well, or some perhaps less emotional, such as ACC interviews or perhaps Housing New Zealand. Please make sure that you understand and you correctly and clearly received the information about all these numbers and dates and names. Ask them to repeat slowly, clearly, or spell if needed. Don't don't be afraid to ask people to repeat what they've just said or rephrase it for you. This is your reputation there, and also be aware that there are so many accents that you have not probably heard before, so that could be a challenge as well. Ask to repeat, ask to spell. Write down, as I said, any information you need. Also, when you can write down some major nouns or verbs, because verbs always mean action. Write down them in the language that the person is speaking. That will be easier for you then to remind yourself or remember and reconstruct that and translate. But also train your memory. If you hear an overlapping talk, please remind the clients or the parties to speak in order. Refer to yourself. I refer to myself as the interpreter. That avoids some inaccuracy and confusion. And if the clients still insist that, or they would like you to refer to them as Mrs. or Miss or Mr. Jones, for example, and to their their party, another party, well, you will have just to be flexible, perhaps. The most important is that everybody understands what is going on and it is as accurate as possible. One of the challenges that I found through my many years of work as telephone interpreter is that sometimes they ask you to interpret things like declarations or anything that they are reading out to you from a piece of paper. And this is one of the most difficult and challenging forms of interpreting. You do not see this written text at all. It's not even sight interpreting, as we can sometimes have in the court, for example, when they give you a piece of paper and you translate it into another language, but you can see the text, at least in the original language. Well, here you cannot see the text. And as you know, that's one of these challenges because the written text and the spoken text are very different and very challenging. So don't be afraid to signal that it's very hard for interpreter, and sometimes it is not even possible if the sentences are the size of the paragraph. Emotional challenges, such as ambulance calls or psychiatric patients or cancer patients, and now we have COVID situation as well. It is okay to be, emotional, but try not to be emotional during the call. But after the call, be kind to yourself. If you need seek for some help or consultation, turn to your employer. Don't think that this is your weakness. This is completely normal to feel emotionally challenged after some disturbing calls, such as about life and death or suicide calls, or some of the calls with the police or theft, and other quite challenging calls that I had faced in the past as well, such as swearing. And so on. Some cultural challenges you will meet as well during the call. For example, one of the situations I've been through was, um, and Hayden probably said that I have PhD in cultural studies as well as masters in linguistics and translation and interpreting. But with my cultural studies, that was very helpful, because one of the Russian clients was, and I could not see obviously the situation, but that was a discussion in one of the social institutions here, and he was offended that the New Zealand managers were smiling and were not, he thought they not taking his matter seriously, and he was complaining to the interpreter, saying, look at them, they're smiling at me. But the New Zealand managers, they were trying to be friendly, because in New Zealand the smile is the symbol of politeness, while in Russia smile is the symbol of trust, and so you smile usually to your friends or family. So these are cultural differences that could create cultural clashes that interpreter would be really good for interpreter to know. There are so many other challenges, but I will leave some, after just a couple of slides, I'll leave some time for questions. So concluding the call, how would usually conclude the call? I would thank the employer. I know that sometimes the employers don't even ask that, but in my past, for example, with language line, there was that line that we always use. Thank you for using language line. With Easy Speak, I do the same, and I think that's a good form to conclude the call. It's a good way. It highlights your employer. It highlights your commitment to that employer, and also, obviously, you do not conclude the call until the parties, both parties, or the party that was the one that connected with you is satisfied, and do not need you anymore. You can always double check whether they need the interpreter still online or not. I do have some points for discussion, just 1, 2, 3, but because we cannot at the moment discuss, probably in our next session we could have some more of a discussion. But I would like you to think, perhaps I already talked about some of the situations, but think, how would you prevent overlapping talk? Or what can you do as an interpreter when you have a bad line or poor sound conditions? And what do you think is an appropriate behavior for an interpreter when the caller is in an emotional state? So please think, and we can discuss that later or in the chat. Just to conclude, I would like to sum up probably and do that overview that remote interpreting definitely has sparked some debates about feasibility, acceptability, or suitability, even of the such conditions, working conditions, also performance quality, and also that requires special training. We're talking today about telephone interpreting that is becoming so popular and necessary, but also very soon. video interpreting and will be perhaps even more popular than telephone interpreting. And I hope that in one of our next sessions, we could also talk about that. And due to interpreters' physical distance and limited or no visual access, it affects their interpersonal communication and particularly in turn taking, coordination, the facilitation of intercultural and sometimes linguistic understanding that I talked before. What are the solutions? Well, there are professional solutions, and I picked up some of them. But the most important is to remember that it takes all parties to make a successful telephone call. Clients and interpreter employers, and also the telephone interpreters, they need to work together to achieve that goal of accuracy that we're all after. And perhaps in the future, NZSTI or we together as the community of interpreters and translators could think of our national protocol for telephone interpreting in New Zealand, since that is definitely not going anywhere, and we will have to adapt to these new conditions, and there will be more and more of telephone and video interpreting from now on.